If you've been sick recently, your doctor may have prescribed you antibiotics such as azithromycin. It's very important that you know the truth about this antibiotic so you can take it the right way and make sure it helps your body fight off the infection. In this video, I'm going to tell you all you need to know about azithromycin, including how it works on fever and cold, and how strong it is on bacteria. So, if you're ready, let's begin. Azithromycin belongs to a group of antibiotics called macrolides. This group also includes other well-known antibiotics, such as clarithromycin and erythromycin. Azithromycin is available as a generic medication and under the brand names Zithromax and Zmax, among others. And it comes in the form of a powder for oral suspension, film-coated tablets, and tablets. You can only get azithromycin with your doctor's prescription. It works by stopping the growth of bacteria. It does this by preventing the bacteria from making proteins that are needed for building cells and for other important functions. Without these proteins, the bacteria cannot grow and multiply, and the infection can clear up. Azithromycin is an antibiotic, which means it is used to treat bacterial infections. It will not work on viral infections like the flu or common cold. Now we come to how long it takes for azithromycin to work. That depends on the type and severity of the infection. For some people, they might start to feel better after just a few days of taking azithromycin, but it's important to keep taking the medication as directed by your doctor, even if you feel better. Stopping early could allow some bacteria to survive and multiply, which could lead to the infection coming back. Azithromycin is a broad-spectrum antibiotic, meaning it can treat a wide range of different bacteria. It's often used to treat infections of the respiratory system, skin and soft tissue, and urogenital tract. Some examples include pneumonia, bronchitis, urinary tract infections, and abscesses. Azithromycin is also sometimes used to prevent and treat infections in people who are at high risk of getting them, such as those with HIV/AIDS. Like all medications, azithromycin can cause side effects, but not everyone will experience them. Common side effects may include diarrhea, nausea, vomiting, stomach pain, and headache. If you experience any side effects, be sure to talk to your doctor. Now let's discuss how strong azithromycin is against bacteria. Azithromycin is considered to be moderately strong against bacteria. It is not as strong as some other antibiotics, such as ciprofloxacin or levofloxacin, but it is still effective against many types of bacteria. The strength of any antibiotic can vary depending on a number of factors, including the type of bacteria, the severity of the infection, and whether the bacteria are resistant to the antibiotic. Many doctors now avoid prescribing azithromycin because there are other antibiotics that are just as effective, but do not cause side effects such as hearing loss or QT prolongation. These include newer antibiotics such as moxifloxacin, gemifloxacin, and delafloxacin. All of these antibiotics are in a class of drugs known as fluoroquinolones. However, azithromycin is still used today for certain types of infections because it has a good safety profile when used appropriately. For example, azithromycin is one of the preferred antibiotics for treating chlamydia trachomatis, Neisseria gonorrhoeae, and Mycoplasma genitalium infections. These are types of sexually transmitted infections. Azithromycin is also used to treat Helicobacter pylori infections. H. pylori is a type of bacteria that can cause stomach ulcers. Azithromycin is often used in combination with other antibiotics to treat H. pylori infections. So, how long does it take for azithromycin to work on fever and cold? If you have a fever and a cold, azithromycin may help you feel better faster. The fever and cold are usually caused by a viral infection. While azithromycin is an antibiotic and won't work on a viral infection, it can help if you have a secondary bacterial infection. This happens when a bacterial infection develops as a complication of the viral infection. For example, the cold could weaken your immune system, allowing bacteria to grow and multiply in your sinuses, throat, or lungs. If this happens, you may develop sinusitis, pharyngitis, or pneumonia. Azithromycin could then be prescribed to treat these bacterial infections. In general, it can take several days for azithromycin to start working on a bacterial infection. Most people will start to feel better within a week of taking azithromycin. So, how long should you take azithromycin for a fever and cold? If you have a fever and cold due to a viral infection, azithromycin is probably not going to help you, and your doctor may not prescribe it to you. However, if you have a fever and cold due to a secondary bacterial infection, azithromycin may be prescribed. In this case, you should take azithromycin for as long as your doctor recommends, even if you start feeling better after a few days. Remember, do not take azithromycin or any other medication without first talking to your doctor. I hope you found this video informative and easy to understand. If you have any questions about azithromycin or any other medication, please leave a comment below. I'll be happy to answer any questions you have. If you like the video, do comment, like, share, and follow for more. Stay healthy.